A good candidate for a penile implant is someone who has erectile dysfunction where the pills are no longer working for you. Meaning with the pills, you are not as hard as you want to be for as long as you want to be. Or if you're taking the pills and having side effects that just make them intolerable, such as headaches or flushing, etc. Though each insurance plan is a little different, most plans do cover the penile prosthesis. In the United States, two different types of penile implants are available. One is a malleable or semi-rigid implant, and the other one is the inflatable implant. Naturally, your penis has two erectile bodies on the top of the penis like this that are cylinders that fill up with blood, and that's how you get an erection. In a malleable implant, instead of having your erectile bodies fill up with blood, there are two rods inside those spaces that keep you rigid, and you can bend it up when you want to have intercourse. They're very easy to use, and patients are very happy with them, and they're certainly more than hard enough to have intercourse. In an inflatable implant, those two cylinders are replaced with these sorts of cylinders that are filled with saline, or salt water. There's a pump that sits down by your testicles that looks like this, and it gets pumped up to then get you an erection. Each implant is sized for the specific patient. During the procedure itself, we measure your penis to find the implant that will give you the most girth and length for your penis. For the malleable or semi-rigid device, the implant is operated simply by bending it up when you want to have intercourse. Very easy. The inflatable device is also pretty easy. There's a pump down by your testicles. You pump it up when you want to have intercourse, and that'll get your penis rigid. It'll stay rigid until you're done, and then you press a little valve button that's in that same area to deflate it and get the saline out of it. The procedure for the penile prosthesis will not change your sense of ejaculation or orgasm at all. This is a very common question. The implant is completely concealed. You could be completely naked in a locker room, no one will be able to tell because everything's on the inside of your body. The implant itself is made of a material called Bioflex. It is a very durable material, which is why it can resist the high pressures that happen during intercourse. The implant is filled with normal saline or salt water. It's very safe, it's not dangerous at all, and is used very commonly in medicine. The procedure to place the penile prosthesis takes about 1 hour. You're asleep for the entire thing. We make a small incision about this big underneath your penis so that when your penis hangs over the testicles, no one can see the incision, and it usually heals up such that you can't see it either. During the procedure, we put the two cylinders inside the penis after we measure them and measure your erectile body, so make sure we get the right length and girth for you. And then we close the area up after we put the other components in. When you wake up, you'll have a catheter in your bladder as well as a drain to decrease some of the swelling after the procedure. Both of those come out before you go home, and you usually stay in the hospital for 1 night just to get some IV antibiotics. In terms of recovery after the penile prosthesis procedure, you stay in the hospital for 1 night and you go home the day after. You're up walking around the same day, if not the morning after the procedure, but we don't want you to have sex or try and use it for about 4 to 6 weeks until the whole thing fully heals up. 6 weeks after your procedure, you'll be able to try out the device and have sex again. A common question we always get is, how long will my implant last? These implants were invented back in the 1970s. We know that 20 years after getting an implant, about half of guys are still actively using them. Satisfaction rates after penile prostheses are very high, well over 90%. Most guys say they would do it again, and I've had many patients say it saved their relationship. Like with all sorts of procedures, there are some risks with a penile implant. Like with any sort of procedure, there's a risk of bleeding and infection. As far as bleeding goes, I tell everybody it's going to look swollen and bruised and ugly initially after the procedure. It's incredibly rare to need blood products, so the bleeding overall risk is low, but it will look bruised. The risk of infection is very low, about 0.6 to 1%. We do something specific called a no-touch technique, which further reduces that risk of infection, where nothing that touches the skin during the procedure touches the implant at all.